How children and families might think, feel, and behave in a pediatric setting. When a child is admitted to hospital or receives a new diagnosis, it's a significant and often distressing event, not just for the child, but for the entire family. In these moments, it's completely normal for mood, well-being, and stress levels to fluctuate. There's no right or wrong way to feel or behave during such uncertainty. What we often see and should expect are responses that may seem out of character, such as tearfulness, withdrawal, anger, clinginess, or even unusual quietness. These are not signs that something is wrong with the child or the family. They are natural human responses to a difficult and often overwhelming situation. As professionals, our role is to hold this in mind and approach families with compassion and flexibility, understanding that this is a process of adjustment for everyone involved.
Whether a hospital admission is planned or unexpected, it can be a significant and sometimes unsettling experience for children or young people and their families. Each child will respond in their own way, shaped by their age, understanding, and any previous encounters with healthcare settings. It is completely normal for children to show behaviours that might seem out of character. The hospital environment can feel overwhelming with unfamiliar people, routines, and equipment which may lead to fear, confusion, or emotional outbursts. Some children may become clingier with their parent or carer, while others might withdraw or become tearful. We also often see regressive behaviours like bedwetting or baby talk as a way of coping with stress. Many children worry about being away from home, their siblings, pets, or school, and this can show up in different ways. These responses are all part of a natural adjustment process. With time, reassurance, and support, most children begin to settle and feel more secure.
Alongside the child or young person, it's important to remember that parents and carers are also navigating a significant emotional adjustment. They are often trying to make sense of unfamiliar surroundings, new information, and in some cases, life-changing news, all while caring for their child. This can lead to increased anxiety, hypervigilance, or needing to feel more in control of care routines. In moments like these, it's completely expected that families might struggle to absorb or retain medical information, even if it's been explained more than once. You may also notice emotional ups and downs, feelings like shock, relief, anger, fear, or guilt, and these can come in waves. These are all normal reactions to being under immense stress while trying to protect and advocate for their child, often while putting their own needs on hold.
Receiving a new diagnosis, particularly one that's chronic, rare, or life-changing, can be a significant emotional shock. It's not just a clinical moment, but a deeply human one. For children, this can bring up a wide range of thoughts and feelings. Many may feel confused about what the diagnosis actually means for them, both now and in the future. Emotions like anger, sadness, or denial are common, especially when trying to make sense of such a big change. Some children might ask, why me, or worry that they have somehow caused their condition. Others may become very focused on the long-term impact, expressing curiosity or fear about what lies ahead. These are all natural, expected responses, not signs of something wrong, but signs that the child is starting to process a major shift in their life and identity.
When a child receives a new diagnosis, families are not only taking in medical facts, they are also beginning a psychological adjustment. This process is sometimes called diagnostic grief. Just like in other forms of grief, parents and carers may move through different emotional stages, including denial, anger, bargaining, sadness, and eventually some level of acceptance. These stages aren't linear, and families may move back and forth between them, especially as new information emerges or their child's needs change. It is not uncommon for families to feel intense emotional distress, such as grief, guilt, and helplessness. They may express this through an increased need for information. They may ask more questions than usual, or seek reassurance in ways that feel repetitive. These responses are attempts to regain a sense of control in a situation that often feels like anything but. You may also notice some parents becoming more protective of their child or questioning medical decisions more closely. This is all part of their process of making sense of the diagnosis and learning how to advocate for their child in this new reality.
When children undergo ongoing or invasive treatments, especially ones that are repetitive or uncomfortable, it can begin to take a toll on their emotional resilience. Even if a procedure is familiar, it does not always become easier over time. In fact, repeated exposure can sometimes lead to increased anticipatory anxiety, phobias, or resistance. Children may try to avoid treatment altogether, either by hiding, refusing medication, or becoming more irritable. These behaviours are not about being difficult, they are often protective factors reflecting the child's need to feel some sense of control or to avoid distress. You might also notice mood changes, emotional shutdown, or children expressing that they feel different from their peers, particularly if treatment disrupts school, play, or social routines. It is important to remember that some children may also show stress physically, like through tummy aches or fatigue, even when there is no clear medical explanation. All of these reactions are understandable. They are signs that the child is trying to cope with the emotional impact of medical treatment, and that they may benefit from extra psychological support to help build resilience and trust.
When a child is undergoing ongoing or invasive medical treatment, families are often managing a great deal, emotionally, practically, and logistically. This can take a toll over time and lead to cumulative stress and exhaustion. It is common for parents or carers to feel overwhelmed or emotionally fatigued, especially if the treatment is complex or long term. They may become hyper alert to any signs of change in their child's condition, constantly scanning for side effects or setbacks. Families may also feel anxious about their ability to manage care at home or worry about making the right decisions. These feelings often come from a deep desire to do everything possible for their child, and guilt can be a natural, though painful, part of that. Recognizing these responses as expected and valid helps us to support families more compassionately during this intense journey.
A sudden change in a child's physical appearance or ability, such as from an injury, illness, or medical procedure, can be deeply distressing. These experiences often carry a sense of loss and trauma, not just physically but emotionally too. Children may feel shock, disbelief, or even grief for how things were before. It is common for them to ask questions like, "Will I go back to normal?" or try to avoid mirrors, visitors, or social situations because of shame or fear of being judged. This can also be a time when children become angry, frustrated, or withdrawn. They may express worries about being teased, excluded, or no longer accepted by their peers. Some may even reject or avoid the part of their body that has changed. It is important to remember that this is all part of the adjustment process. Children need time to reframe their identity, redefine what's normal for them, and learn to navigate life with this new change.
When a child experiences a sudden change in appearance or ability, parents and carers often begin their own journey of adjustment. It is normal for families to grieve the loss of how things used to be, how their child looked, moved, or functioned before the change. Alongside this grief, families may be filled with worry about what the future holds. Will their child regain independence? How will this affect their confidence, friendships, or self-esteem? These concerns can feel overwhelming and may lead to an increase in questions as parents seek clarity and reassurance from the medical team. Guilt is also a common response, particularly if the change happened following an accident or illness. Parents may replay events in their mind, wondering if something could have been done differently. In some cases, this guilt can lead them to overcompensate by doing everything for their child, even tasks that their child is capable of doing. It is important to recognize these behaviors not as resistance or an overreaction, but as signs of a natural part of psychological adjustment in the face of sudden and what may be a life-altering change.
It is important when working with children and families to remember that emotional reactions to hospital admissions, diagnoses, or treatments are usually temporary. These responses often peak within the first few days or weeks, and in many cases they gradually settle as families adjust. However, we should keep an eye on emotional or behavioural signs, particularly if they seem disproportionate, intensify, or don't improve after a few weeks. In those situations, it may be appropriate to signpost or refer to Health in Mind for more targeted psychological support. Families often benefit from empathetic reassurance. Whilst it is not realistic to expect them to stop worrying altogether, simply holding space for their emotions without a pressure to stay positive can be incredibly validating. Responses that are met with kindness, compassion, and patience can go a long way in helping families feel supported. Finally, be mindful of any cultural or religious influences that may shape how a family is interpreting and reacting to their child's condition or care. These factors can deeply affect communication, coping styles, and expectations.